Okay, it is March 7th. May 7th. To date, we have tested 459 people in Lewis County. We found 12 positive cases of COVID-19. Of those 12 cases, 11 people have recovered, which is wonderful. This week, we have been working with Lewis County Health System staff and the Public Health Department to test every single resident and staff member at the nursing home in Loudville. So we'll be wrapping up those tests this week, and so that was a great state initiative to make sure that we're really covering all of our bases with that population. I want to talk briefly about reopening. That seems to be the hot topic these days. So the governor has established 12 criteria that each region of the state has to meet before we can open up as a region. I'm not going to go through all 12, but I will tell you that the North Country does quite well in those categories. Basically, you can split those 12 categories into three larger pieces. The first is your number of infections, your rate of infections, and the intensity of the spread in your community. Obviously, in the North Country and in Lewis County in particular, we do quite well with those numbers. We have had low numbers of positives in Lewis County, and we've been able to isolate those cases and prevent the spread quite effectively throughout our community. The second category is healthcare capacity, making sure that we are prepared for a ramp up if necessary. So that's measuring things like excess capacity of ICU beds, excess capacity of PPE, protective equipment for healthcare workers. Again, that is a category that Lewis County does very well in. We have plenty of access capacity at our health system, and we have decent amounts of PPE that we have stockpiled at this point for future use if need be. The third category is where the region and really the entire state struggles a little bit more, and that category is about testing capacity. So if you look at the 12 bullet points that the governor has established for reopening, one of them is about testing capacity. And what it says is that each region has to test 30 people per every 1,000 citizens each month. So in Lewis County, we have 27,000 people. So if we have to test 30 out of every 1,000 people every month, we have to do 810 tests per month. Now, once we get the new machine, instant testing machine that Jerry Kerr talked about last week, once we get that up and running at the health system, that's going to allow us to process the tests at a rate that is acceptable. So we'll be able to do 810 tests per month, but we have to have the proper equipment, and that is test swabs. This is basically what we're looking at here. It's called a viral transport medium, and basically it's a Q-tip with a vial of saline solution, and the Q-tip collects the specimen, then the specimen goes in the vial and it gets sent over to the lab at the hospital, and they can process that. However, we only have about 300 of these on hand here in Lewis County, and we've only received about 100 from the state. So we did receive more this week to do nursing home testing, but other than that, we haven't received what we've needed from the state or the federal government. So what I'm trying to say is that 810 tests per month is feasible. It makes sense. It's a number that I think will keep us safe in the long run if we're able to test that much, but we don't have the equipment to do that. And if we're going to reopen in the North Country and in Lewis County, we're going to need more of these test kits. So that's something that we're working on, working with the region, working with manufacturers. Hopefully there's a way that we can get more of these so that we can ramp up our testing. For the region, if we have to do 810 tests in Lewis County, that means the region of the North Country, 7 counties, has to do 13,000 tests per month. So this is not something that is going to be just a problem for Lewis County. All of our county counterparts throughout our region are going to struggle to hit that threshold of a collective 13,000 per month. So to me, that's probably the biggest barrier to a full reopening in the North Country per the governor's standards. Speaking of reopening, I just want to talk more broadly about the situation in New York State and urge some patience. I know everyone is eager to reopen. Trust me, we are as eager as anybody here at the county. I'm going to talk a little bit about our finances in a bit, but we're being affected by this as much as anyone is. But we have to understand that Lewis County is part of New York State. Even though sometimes we don't feel much like Manhattan, we are very much connected to New York City and the New York metropolitan area. So when you look at the worst case scenario for the state, the worst case scenario is a second round of outbreaks in New York City. That would mean the entire city and the entire metro area of New York City would have to shut down for another month or more. So when you look at what Albany is trying to do and what their decision making is, they're trying to think of the 12 million people down there and the hundreds of billions of dollars of economic activity generated by the city and making sure that that doesn't flare up again. And it doesn't seem like it would have a big impact on us because we're so far away, but it does. Because all of our roads, our bridges, our schools, all of the funding for programs in Lewis County come from New York State. A lot of it does. And the point is, Lewis County definitely receives more from New York State than we put in. And so we do need to think of ourselves as one state, and we are connected to the city, even though sometimes it doesn't feel like it. So we want to get going, we want to get up and running. I believe that we will be able to do it much faster and much safer than New York City, but we do have to remind ourselves that we are part of that larger state system. And that's worth remembering when we go down a rural road, for example, with a bridge that only serves 25 homes. That bridge was millions of dollars, and it probably wasn't taxpayer money from Lewis County that paid to redo that bridge. It was money that came from all those millions of people downstate. So we share with them, they share with us. That's how the state works, and we have to understand there is a larger system. As frustrating as it is, and trust me, it is frustrating, we're all frustrated here as well. So speaking of finances, I want to talk briefly about the county finances. This public health emergency is starting to become a pretty serious economic emergency for New York State as well. We did receive our March sales tax figures today. We were down 30% from March of 2019. That means in 1 month we lost $226,000 compared to the previous month. Our projections from the New York State Association of Counties are that sales tax will be down across the state 20%. That would be $1.5 million total for Lewis County. Also, state aid cuts. The governor has announced up to 50% state aid cuts from their state budget to counties. For us, a 50% cut in state revenue would be $3.5 million. So between sales tax and state aid, that makes up $5 million in revenue. We run about a $50 million annual operating budget. So $5 million out of $50 million is a 10% deficit, and we're only in May. So that's the figures that we're working with. When you have a revenue shortfall, what you need to do is make associated cuts. So we are putting together a bundle of cost-saving measures that will allow us to react as the numbers come in. Maybe sales tax won't be that bad. Maybe our state aid won't be truly cut 50%. What we are going to do is we're going to watch that very carefully, and we're going to make sure that our county spending does not outpace the revenue that we're expecting to receive. So if revenue comes in, 10% low, like we think it might, then we'll make sure that our spending is appropriate. If it only comes in 5% low, then we'll make sure that spending is appropriate. We will make sure that at the end of the year, we're not having to dig too far into our rainy day fund. Capital projects, roads, bridges, and other public works construction, those things are under review. Discretionary spending is under review. as well as a program that we announced, approved by the Board of Legislators last night for voluntary furloughs of employees. We'll be accepting 26 voluntary furloughs of Lewis County employees. We've been working very closely with the union. They've been wonderful to work with to date. And we'll take these volunteers from throughout our organization. So it won't be one department and one service that will be decimated. It will be spread throughout all 27 departments so that any one service to Lewis County residents isn't limited. We have a responsibility to our employees, but we also have a responsibility to our taxpayers. We do have a good rainy day fund, but if we know revenue is going to be short and we've got another 8 months before the end of the year, we might as well start adjusting our spending appropriately. So with that, I will turn it over to Mr. Kerr with the health system for any comments on the health system. We also have Ashley Waite with the public health department.
Okay, thank you, Ryan. 3 points. The analyzer that will allow us to test for COVID-19 is on schedule to arrive next week. Ryan already addressed, the challenges of having the test kits that we will need to test 810 people. For routine testing, as we have been doing with public health over the last couple of months, we have adequate supplies. Though the delay at this point is going to be reagents, and that's an essential component for the analyzer to process the specimen. And right now, the production facilities are having a difficult time meeting the need. So these kinds of analyzers have gone out all over the country, and the increase in testing all over the country is putting a real strain on access to reagents. So it's something that we are following very closely and working with many vendors to try to address. Today was our first day with the restart of elective surgeries. So we have a solid schedule for today and tomorrow. Next week we are up to over 25 elective surgeries having been scheduled. And in about a 2-week period, we should be up in our normal range of 30 to 45 scheduled surgeries. The only type of surgery that we will not be doing for this short period of time are those surgeries that are non-emergent and require hospitalization. And that's really being driven by DOH guidance, whereas there's a real concern that beds would be filled by elective patients who require hospitalization. So we'll work through that process. I'm cautiously optimistic in the not too distant future we'll be able to do that. And then lastly, just want to acknowledge the good work of the nursing service, public health, that collaboration in getting the staff and the residents tested at the nursing home. As of 2:30 this afternoon, we were at 100% with staff, and those who hadn't been tested are scheduled to be tested. And we will have all the residents tested by Friday with the exception of one. And there's some underlying reasons for that. So we will be able to meet the state's directive so that they can get a snapshot of what's happening in long-term care throughout our state. We've been very fortunate, and in previous press briefings we've talked about, and I've acknowledged the good work of the staff at the nursing home in keeping the residents safe and really allowing the families to have trust and faith that the right things are happening. So that's my update.
One more thing, Nick, that I forgot is the Lewis County Board of Legislators. I have to give them credit. They have been very clear about the expectations during the, as we look at the finances of the county. They've provided great leadership. And on Tuesday night, they also voted to take a 10% reduction in their pay as legislators as long as the voluntary furlough lasts. So everybody's contributing and trying to do the best for Lewis County.
Okay. Is there an update from Ashley or
I'll
direct
take
to questions? Okay. Seems how I'm the only one here, I guess I'll go through each of you the questions if that's okay. Jerry, as far as from the hospital standpoint, just a couple of quick things to check through. With the reopening guidelines and the capacity at the hospital, is there any clarification? Are those, the hospital capacity, is that based on pre-COVID capacity or the 100 or the 50% step up that you had to do?
Yep, pre-COVID or the original licensed beds, which is 25 for us.
Okay.
And they are not counting the surge capacity that we built in.
Okay. And I know that you said with the nursing home testing that the swabs kind of came from the state as it was a state directive. You got exactly enough of what you needed to test the residents and the staff there at the nursing home. Just as we're looking forward, and maybe you don't have any clarity on this question, but do you think a similar situation might happen when we get to the point of reopening and the governor is saying you need 800 tests a month? Do you think maybe you'll just get a box with 810 swabs in it?
Well, I like your thinking. I think if you know, by and large, I think the leadership in Albany and the Department of Health have really done a nice job in handling an incredible challenge. You know, New York City in that metro region was the epicenter in our country for this outbreak. Has everything gone perfectly? No. You know, I've heard the governor speak almost daily, and he has reflected some of what is happening is being written as we go. And what has been discovered is as you increase testing, it's more than just the analyzer. There are stock items you need to complete the testing process. The production facilities are not adequate to meet the ultimate goal of testing, you know, 30 people out of 1,000 across the country. So it wasn't this gradual or general buildup to the supplies. It's overnight there is a number, and there are not enough swabs, reagents to make this possible. So, you know, I think both Washington and New York are not appreciating that it is hard for a local government, a local health system, a local business to create the adequate number of swabs and reagents so that we can meet that goal. And in some ways, I understand the epidemiology behind it, but when you put a goal out there but you don't have the tools to achieve the goal, that there's a real disconnect there. So, you know, I had a chance to talk with Representative Stefanik, who has really done an outstanding job championing the issues of the North Country and of District 21. She understands. I think she's working very hard on our behalf to really help us address the swabs and the reagents and some other things. So I think, and I'd be remiss if I didn't mention Senator Schumer, Senator Gillibrand. They also have been working tirelessly. But at the end of the day, when it's all said and done, without the production facilities, it will be hard for this country, for this state, and this county to move forward and meet the goals of testing that have been laid before us.
Okay.
Can I comment on that too, Nick, real quick?
Sure.
So Jerry hit the nail right on the head, but a little more bluntly speaking, why is it up to Lewis County of 27,000 residents, or even the North Country region of 400,000 residents, to come up with a supply chain and build the supply chain capacity to keep our residents safe? The 30 tests per 1,000 is not a New York State arbitrary number. That comes from the CDC. The federal government knows what it's going to take to get us back to an open, healthy, and safe society. It's going to take wide-scale testing and wide-scale tracing and isolating the positives. The fact that both the state and the federal government, and yes, we have very supportive local representatives, but the fact that they have failed to provide this necessary testing equipment is really very disappointing. And it's the reason why we're going to be stuck in this purgatory between not being able to fully reopen, but not having a lot of tests, we're going to be stuck there for some time until somebody figures out how to get enough of these made so that we can test widely throughout the whole state and the country. So this is not just a Lewis County problem. This is going to be a problem for the entire nation until somebody, gets these manufacturers moving. That's my opinion.
Okay. And I think you touched on it a little bit earlier, Jerry, but just to clarify so people have a better understanding, the testing of the nursing home residents and staff was actually mandated by the state as they're trying to get, or not mandated, but
It's a directive.
directive from the state.
Correct.
Okay.
And there is a little bit of wiggle room when it comes to the residents. There's absolutely no wiggle room when it comes to the staff. And so fortunately, our staff, some have not been pleased, would be fair, because it is an uncomfortable process. But this is also the same staff that have worked well together to make sure the residents are safe, that the virus doesn't enter our health system. So deep down, the organization wants to do the best thing always for the residents. So the good news is people are working with us, and not everyone's pleased, but give me any group and you're never going to get 100% of the individuals being excited about everything all of the time. And so we just have to work through that process, and that's really a management's responsibility, and to make sure we enforce policies. And once we got that guidance from the state, we actually changed our COVID-19 policy, because in my mind, and as I have shared with Ryan and Ashley, before you work in healthcare, you have to have a TB test. You have a PPD. We have been putting thermometers in people's ears now for 2 months, so we're screening in that way. There are vaccinations that you must have before you work in healthcare. So this notion of public health entities guiding us and directing us is not new in healthcare. And for me, it's just part of that process. The governor hit the nail on the head the other day when he said, if you don't wear a mask, you're being selfish. If you work in healthcare, in long-term care specifically, and you are not swabbed for COVID-19, you're being selfish. And I fundamentally believe that.
Perfect. And the last question for you, Jerry, relating to the health system. I know you said that elective surgeries started back up today. You got a full schedule going next week. So can you just talk a little bit about how long is it going to take to get through the backlogs of the surgeries that you missed? And can you make up for the lost surgeries over time, or how does that work?
Yeah, I think over time we'll be able to make up for it. One of the operational challenges, no earlier than 3 days before the surgery, the patient has to be tested for COVID-19. And so it becomes sort of a production process. Well, we can't miss a day. So in order for us to do surgeries on Wednesday, we need to take your sample on Sunday, Tuesday, Saturday. Now, for 6 days out of the week, our materials are then gathered, brought to Syracuse, and then they're flown to a reference lab. On Sunday, they don't fly. So we are working through a process to make sure that the samples we take on Sunday are delivered to the reference lab so we get the results of the person's surgery. And in part, once we get our analyzer locally with adequate reagents, that goes away. So by and large, it's working pretty well. It'll take probably a couple of months to work through the backlog, maybe a little bit longer. But we're off to a good start today. We got a lot of cases scheduled for next week. We have a team meeting every morning at 7 and every afternoon at 4, just to make sure all the T's are crossed, I's dotted, left hand, right hand know what they're doing, so that we can meet community need.
Thank you.
You're welcome.
And if, in recognition of National Nurses Week, if you could just take a message back to your nursing staff at the hospital that the community is very supportive and appreciative of everything they've been doing. Not just nurses, all the staff, but It's
And
National
we've
Nurses
really
Week, so.
felt that, Nick. We have really felt that, and Christina Flint has worked with us to get some messaging out to the community. I've penned a number of thank you notes, and so what we're doing organizationally next week, we're bringing both celebratory recognition for the hospital healthcare providers and the nursing home healthcare providers, home health and hospice, and our physician practices, and we're having a healthcare celebration for all of their good work. So every day next week there are special events recognizing social distancing. So there's lots of food and gift certificates, and you know, Monday, for example, is Red, White, and Blue Day. So some good activities that the team led by Michelle Kelly has pulled together. So I think we're going to have a good week, because right now people are a little bit tired. I think quarantine fatigue has set in, or pause fatigue has settled in, and you can just tell, you know, there's a little edge, and so this will be a reprieve from what we've had to live through the last couple of months.
Perfect. Thank you.
You're welcome.
Okay. We did have some questions on the furlough proposals, Ryan. Unfortunately, this all took place in an executive session, so we weren't super versed in the conversation and how this all took place. But maybe we could just start out by explaining, is there a reason that the entire furlough conversation was held in executive session?
Yeah, so anytime we begin talking about individual positions and the employment status of our individual employees, that's something that we don't want to discuss in front of the press and the public. So we do try to be sensitive to our employees, and we also want to make sure that they're communicated to without having to read about intense things relating to their employment in the press, right? We want to communicate with them first, give them an opportunity to hear it from us, hear the facts before they read about the status of their job in the newspaper. So that's why we try to do that behind closed doors.
When you're doing such a broad policy like a furlough policy, though, I mean, it's not really individually into personnel for any single employee. You're talking broadly furloughs.
Yeah, true, but we also have, we do have 200, plus staff members, but every individual unit, when you start talking about it, isn't very hard to figure out who those people are individually. So yes, we have 65 people at DSS, but anytime you start talking about caseworkers specifically, or employment and training folks specifically, you're talking about a really narrow subset of maybe only 2 or 3 or 4 people. So we didn't think it's fair, and we do believe that New York State law allows us to use executive session so that we're not discussing people's employment status and where we have maybe some slack in our organization, and where we would look for more targeted cuts in front of the press and the public.
Okay. Jefferson County did a similar situation at their meeting at the beginning of May, and everything happened in open session on the furlough discussion. But anyway, going back to the furlough discussion, again, the reason I bring that point up is because we have a lot of questions that we don't really have answers to. So one of the questions is this a done deal? Are we 100% moving forward with furloughs? It seems like there's some misunderstanding whether it's just collecting the data to bring back to the legislators to see if they want to move forward with it, or if it's a policy that's actually going to be moving forward. So have the legislators actually authorized the furlough process?
Yes, they have. Yes, they gave the county manager authority outside of executive session to begin the furlough process. So what we need to do first is I communicated with employees that this is something that's going to be happening, something that we're exploring. Obviously, we worked with department heads in the previous week to get some semblance of a plan together. Then what we need to do is sit down with the union and make sure that we have a memorandum of agreement, which is basically a written document that establishes the terms and conditions of the furlough. It is, I think, the most important thing that we need to relay to the public and to our staff is that this is a voluntary furlough plan. So we're not forcing anybody to go without a paycheck. But if we have staff members who feel uncomfortable coming into work right now because of what's happening with the public health situation, or they feel that because of childcare reasons, or perhaps they're taking care of an elderly parent, that they're not able to get into work their normal hours, then this is an opportunity for the county to save some money and to provide some flexibility to those employees who maybe would prefer to stay home during this kind of unique time. So that's the goal. Our first step will be making sure that we have that agreement with the union, which will be pretty simple since the hospital already did most of the groundwork for it. And then we will have a special meeting of the Board of Legislators next week where we will have the legislators approve the agreement with the union. And then from there, we can accept volunteers and get moving on the actual furlough itself.
Okay. So will they just be voting on the approval of the memorandum with the union, or are they going to be voting on the furlough plan at that point? Or is it one and the same?
One and the same, I would say. Just they'll be voting to approve the MOA with the union, but the MOA with the union will spell out exactly the number of positions that we're looking to seek through the voluntary furlough.
Okay, thank you. As far as with the budgeting, I know that you discussed the sales tax payment for March came in this morning. It was about 30% under what last year. I know in your estimates, when you're estimating what's going to happen with the county sales tax, you guys are kind of basing it on a 20% loss for the year. When you see March, and the pandemic kind of started halfway through the month of March, would you read into that you might see larger than 30% drops for April and May and June?
Well, your reasoning is correct, Nick, and that's why we are a little bit nervous because, yep, March numbers really, and March was only 2.5, 3 weeks of this quarantine and slower economic activity. April, it's going to be the whole month. So, we've had estimates, anywhere from 10% to 50%. When you shut down the economy completely, how many transactions are happening, and we don't have any idea of how many people are shopping online. So yes, that your reasoning is correct, but the whole point of our financial management of what we're doing right now with the furloughs and looking at our capital projects is we want to be reactive to the revenue situation. So as revenue comes in and as we can measure it, right now everything is a lot of guessing and it's very uncertain. But as those numbers come in, as our state aid comes in, as the sales tax comes in, we'll have a better idea of where things are going to be. And so along the way, as we get a shortfall here, we cut a little spending here. If sales tax comes in for April a little bit lower, then we'll have to take a look at some other cuts. The point is, you don't get to the end of the year and have a gigantic budget deficit. If you can make some targeted cuts along the way, you're not going to face such a huge situation at the end of the year. So that's what we're trying to do.
Okay. And I guess a question for Ashley would be, so we did go 15 days in a row, I believe it was, without reporting a new COVID case. Mm-hmm. And I think we did report a new COVID case yesterday afternoon. So I didn't know if you had any additional information you could share as far as that. I think basically you said that the report stated that it was likely the exposure took place outside of the county?
Yep. We did identify an out-of-county exposure, and the individual is isolating at home. Okay,
perfect. And obviously we saw quite a ramp up with the number of tested people in this morning's report. So assuming that has to do with the starting of the nursing home and the staff and residents there yesterday?
Yes.
Okay, yep. Perfect. And I hate to ask this question, Jerry, but are there any kind of plans in place, if God forbid a positive result does come back affecting one of the staff or residents at the nursing home, are you guys got a plan in place and ready to jump into action with that?
Yes, if it's a staff member, there's some established guidelines on how that person will be managed. And there are also established guidelines if there's a positive in the nursing home. From a resident perspective, I don't want to go off the top of my head because I could mislead, but there are plans in place for either of those scenarios. I think I am cautiously optimistic all of ours will be negative, in large part because of the constant surveillance we are doing every single day before people come into the institution. So it's actually, of all the things I worry about, that is not one right now. I would worry more if we didn't do it, because I think every opportunity to reaffirm to the staff, to the families, to the residents, our status is very helpful during this time.
For sure.
Yep.
And just one last question for Ashley, and might be asking a little more for opinion so much on this, but just with the hospital and the nursing home being such a large employer in the county, from your standpoint and from a public health standpoint, do you see this as a good opportunity, just kind of like a window into the community as how, you know, what things are looking like here in Lewis County by being able to test that many people?
I think it gives us, you know, a larger sample within the community, which is absolutely needed, but I don't think it speaks to the community at large, because, you know, we have pockets of people all over throughout the county.
And understanding
Any
that a lot of
testing is going-
those people probably, some of the people that work there also don't actually live in the county as well, so.
Right, yeah,
Right.
absolutely.
Perfect. Okay, if there's nothing else from any of you guys, I think I'm all set.
Great.
Okay, we're